My name is Leslie Love. I have a lot to say, and I don't have all the time, but I would like to share with you. I was a patient at UC Davis for 20 plus years. I've had several surgeries. The last surgery I had a total knee replacement, and I was in a convalescent home for 2 weeks, and I went back to UC Davis to started my physical therapy. Right in the middle of my physical therapy, I got kicked out. It was so important. The doctor said, and forgive me because I get very emotional with this because I'm hurt. The doctor said physical therapy is very important to have after you have your knee replacement. Well, 3 months I had physical therapy. They kicked me out.
My name is Kim Williams, and I'm the Hub Director for Sacramento Building Healthy Communities. And we're here today because we really want to ask UC Davis Medical Center to reconsider their role as a primary care Medi-Cal provider for low-income patients in Sacramento, especially the hospital anchoring Oak Park in this community, and with the number of low-income residents that live even in this community that can't access the hospital for primary care services and that be their health home, that concerns us greatly. And so we're here today to talk about that issue. We've got some guests who are going to share their stories and their information with you. So we're going to go ahead and get started. And our first speaker today is going to be none other than our own Senator Dr. Penn.
Well, it's great to be here with all of you today, and certainly I want to thank you so much for inviting me, and I see all the medical students here, right? So it is time for UC to step up. It is time for them to no longer be silent, to no longer to allow Medi-Cal patients to quietly not be able to get care.
My name is Ian Kim. I'm a third-year medical student here at UC Davis. I'm proud to be a UC Davis medical student. When I started school here a couple years ago, I bought this stethoscope, and I made a commitment with this instrument to learn how to place this stethoscope over the hearts of people who need care the most. As a learner in medical school, I feel like that's my job. But one thing boggles the mind. One thing about this health system is embarrassing and heartbreaking, is that we don't provide primary care for Medi-Cal. You know, we know that an ounce of prevention is worth a pound of cure, right? A 15-minute visit with the doctor can keep you away from a 15-day stay in the hospital. Access to 15-minute visits with your primary care doctor can help you to extend your life by 15 years, right? We know this. So UC Davis Health System made a mistake when it let Health Net Insurance walk away without a fight 2 years ago. So having said that, I just want to end by saying this health system has a choice to make. We can look at this issue of primary care for the poor in one of two ways. Do we believe that care for the poor is a burden? That it's a low priority, that isn't worth the financial risk? No. Or do we believe that care for the poor is a badge of honor?
Yes.
One of the things that gives this health system its greatest purpose and meaning.
But I would not let this break me. I would not let it break me. I would continue to fight for
Join us in urging UC Davis to take these important steps so that our region's poorest individuals are not left with only the emergency department to turn to for their access to primary care.
Help us treat this community that we live in and that we're supposedly dedicated to.
And we continue to ask you to do what you can as well to help push on the system, to help them see what they need to do to help make sure that our residents, all of our residents, our low income, specifically residents, are able to access quality health care. It's about fairness for everybody. It's health for all, not health for those who have this or that. It's everyone. It's a basic human need.